Welcome to the Depth Perception Podcast.
We go in depth about the perception and misconceptions of optometry,
which include the business of optometry,
social issues within optometry,
and life as an optometry student.
Coming straight from Dr. Jasdeep Singh Soni,
Dr. Nadia Afghami,
Dr. Douglas Akiti,
and Dr. Svetlana Nunez. We hope you enjoy this episode.
Welcome back to the pod. We got three of us here. Who do we got here? Everybody introduce themselves.
I'm Dr. Nadia.
Dr. Doug, what up, what up?
Jasdeep Soni. So Nadia, when you walk in the room, do you say Dr. Nadia? Like you don't say your last name?
No, I do, but this is for the pod. You know, this is...
So for the pod, you say doctor, but then you say your first name.
Yeah, I figured we're keeping it cash. I'll tell you, Nadia.
Okay. So casual doctor. Why not just say Nadia?
I'm just going to be like, hi, Dr. Jasdeep Soni. What about the next question in the pod?
That works. Okay, we'll move on.
So what are we
talking about today? Exactly. I'm Jasdeep Soni. That's what I said. All right, let's move on. What are we talking about today? We're talking about what to do when you don't know what to do, which happens more often than you think. Right, guys?
Absolutely.
All the time.
But what does that mean? What do you do when you don't know what to do? What aspect are we talking about, JD?
Let's ask Nadia. So Nadia, you came up with this topic, which I thought was fascinating. It gave me a gut feeling. What came to your head when you suggested this topic?
You know, sometimes you're in clinic and you just see something and you don't know what to do. So then what do you do?
100%. Happens at least once a day, if not more.
Right.
I guess from a referral standpoint, I text my buddy who's a retina MD and I just say, what would you do? I don't know what to do. Nevis, right? Nevis is all the time. I'm like, is that a Nevis? Do I need to see this? Do I need to refer it? Does this look like a tear? I'm always sending that.
Okay, so let's say you didn't have your retina friend. What would you do?
Before I became close with him, I would reach out to some type of MD. Whether it was unfortunately worked with an MD for 2 years. So I would reach out to some type of MD, whether it's retina, cornea, some type of, that's where we become friends and network. What about you guys?
Well, before I feel like we go, I want to ask, because I feel like a lot of people are wondering, how do you have all these doctor friends? Who are these buddies? How did you just establish friendships with people who are MD or retina specialists? Like, how do you make these networks and establish these relationships as an OD?
All right, here's a future magic clip that they're going to put on Instagram because this is such great tips for y'all, all right? So When you move to a town, when you get a job, go to the local society meetings, go to the offices of the MDs, introduce yourself, shake their hand. They want to help you because they want referrals, so they will be kind to you. They will take you to lunch. You partake, get to know them, be buddies with them, play pickleball with them, get to know them, send them patients, but then also you rely on them for value. It's an equal source of value, right? You're providing referrals, they're providing you guidance on what to do and when to refer. And so it's a mutually beneficial relationship that everybody can prosper from. So go to your local society meetings, go shake some hands, go to some offices, get some dinner. That's my advice.
Play some pickleball. Got it. That's awesome. Nadia, what about you? What advice would you give in terms of networking with MDs or specialists?
Yeah, I think that in Florida, I had some contacts that I would text, like, especially for cornea. I'd be like, what is this cornea thing? Because cornea is like, I'm not as great at. And it's a good resource to have because I'd be like, can you fit them in? I have the direct number. But here it's hard. I don't know. I don't really know that many people. So there's like one OMD that like their office is really nice. So I'll text their like office manager sometimes, but I'm never like, what do you think about this patient, office manager? Like I think too, I was working in corporate for a little bit. And even though before I was like seeing like medical so often, I like forgot like what to do. So it's hard.
But the question is, how did you get to getting to text this office manager? Like, how did you meet that office, those people?
They came by our office and they were like, oh, send us your referrals. And then they just got my number.
Bingo. They want something from you too.
Yeah. So I'll
Did
refer.
Did they ever take you to lunch, take you to pickleball, any of the such?
No pickleball, but I was at the Christmas party. So we had a barbecue. That was like the last week I was not super like pregnant feeling. And then no more barbecue after that.
What about you, Doug?
I feel like I just rely on my friends who are like you guys. People like, yo, if I have any questions, I'll just ask y'all because you guys are so well connected. You guys have been in the game for a while. Then if you don't know, you would ask somebody. So I think there's always someone. Or just any of my like bosses or like people above me who I just know have been doing it for a long time. I just text pictures, send things, and they send it right back. They're pretty good at that. So again, it's all networking. It all comes down to that.
Which you were doing in school too, right? These are your homies who don't judge you, who already know about you, who already saw you in school. Like there's no shame. They already know what you're at. Nadia's already has like one of those phone calls, like, just like the Russia and US, they had that phone call so people wouldn't kill each other during the Cold War. She has that with her best friend Libna, and so they talk about everything, right? Like you just have to have that direct access with your besties who will respond at all times.
Yeah, call her.
Yeah.
Hi, I need consult. I need consult. I have friends who
I
like are
need
different. Like if I have a retina thing, then I'll call Libna. If I have a cornea thing, I'll call my friend Rachel, and then I'll be like,
Oh,
"What should I do with my cornea patient?" Because she did like a cornea residency, and Libna did like a more like retina based kind of residency. So, but also like it's nice because I used to be in an associate practice, so I used to have another doctor there with me. So we would consult each other all the time, which I think like helped me grow tremendously because she was like been practicing for a year and then I was just out of school. So we kind of like played off of each other with knowledge. And so we would sometimes be like, what do you think this is? And then we'd both like be looking in our wills, and then I'd confirm my treatments with her, like, oh, do you think I should do prednisone for like 4 days? And she'd be like, yeah, or like, no, I'd probably do whatever. I think people who are in an associate practice are different than like if we're alone. Does that make sense? Like you don't have anyone sometimes to ask to, so you have to make a phone call. But then JD, let's say you're asking your retina friend, like, what do you do? Do you leave the patient in the room while you're like, let me go text somebody? Or like what's happening in that time?
Great question. Yeah.
majority of the time, yeah, I'll just leave them and be like, hey, I text my buddy and then I go to another room and see another patient so I don't waste time. But sometimes I'll just like do it in front of them. I'm like, hey, are you okay if I call my retina specialist friend in front of you or text him, and I'll pull up my phone and then I'll like analyze and talk to them while I'm doing it. I think it's just about what kind of comfort level you have with that patient, what kind of comfort level you have in saying, hey, I may not be the expert in this, and saying, hey, I just need some space and some time. What about you guys when you consult on friends or specialists or whatever it may be?
I think that this is one of those things where like you have to be okay with being like shameless and being super transparent and open. I feel like most patients are happy and okay when you let them know like, hey, I'm not really sure, but let me talk to one of my colleagues who let me just discuss and see what we can do about this or what my colleague thinks. And when they see you getting that second opinion, they have more confidence in you because they know that you're like being transparent and you're not trying to hide or act like you know everything. Honey, what do you think?
Yeah, again, when I was in like the associate practice, right? It was like I could be like, actually, let me go grab my associate for like a second opinion. Cause like sometimes I was like, maybe my BIO is not that good. Am I missing something? So I'd be like, can you just come like double check? And then I'd be like, do you mind if we just get a second opinion? Or she'd come grab me and be like, can you come look at this cornea thing? And I'd look, so it was nice in that way. But usually when I'm alone, I'm sneakier about it. Like I'm like, oh, let me grab you some artificial tears. And then I like go to the back and then I make my phone call or I like chat GPT or whatever I'm doing. So I mean, like, you come out of school and you don't know everything. Like you can't just know everything, right? Like you know a lot, but sometimes you there's stuff and then you're like, ooh, I feel like I've seen this before, but I don't remember exactly like the dosage that I'm supposed to use or like, oh my gosh, this is so embarrassing. Recently, like I used to, like I said, manage disease a lot. And I had a patient with EKC and I was like, okay, it's self-resolving, like whatever. And I remembered that I like used to give pred because it's been a while since I've like not been in like the medical side of optometry, right? And I was like, okay, usually I like give pred. So I tell the patient like, okay, but it could be an infection. So let me give you like Tobradex. And then later the patient left and I was like, I don't think that was a good treatment plan. So like, then I called her back. I was like, hey, I've been thinking about it. I'm going to just give you the steroid. I'm pretty sure like I'm thinking about it and I think it's more viral. I don't think the antibiotic would help, blah, blah, blah. Right. So I'm like, don't get the Tobradex, just get the prednisolone. But like things like that happen, right? Like I used to be like so good at it and I'm out of practice. So it gets to that part where it's like, okay, it's better for me to like just call the patient and be like, hey, sorry, I don't think this is the right treatment than to just let them like go like 3 days and then see them. Right.
Agreed. Like Doug was saying, no shame. Like what's best for them.
Can't
I
always
think
just try to be the game. You gotta, put your pride aside and just let them know, hey, I might have messed up on that one. Well, I wouldn't say that. I wouldn't say I messed
No,
up. But
Yeah,
I just
yeah.
said I was
respectfully
thinking about it and I actually
yeah.
think that,
I think this job will be a lot better than the other one.
yeah.
So just get
I was like,
the
this
first
drop's
one.
going to
Don't
be
worry about
stronger
that
for
second one.
you. Yeah. A little less, we don't need
Exactly.
blah, blah,
Exactly.
blah.
All right, so key things you already said, talking to like specialists. Doug said talking to friends. You were saying you were talking to some of your friends too, and then you said you talked to other offices. I like that you also mentioned Will's Eye. That is like a clutch one for me. I always go to Will's Eye, step outside and read that first. Like anytime I have a papilledema or pseudopapilledema patient, I'm always copping down what Will's Eye says. Do a MRI with gadolinium or whatever, and make sure to go to ER or urgent care and just copy it and paste it. And same thing with some of the stuff with some of those scary things, the scary pseudopapilledema, the swollen nerves, right? So like when I'm lost, Will's Eye is like the Bible. That's what I say.
Yeah, and I love the newer Will's Eye where it's like digital, so you can just look it up on your phone, look it up on your tablet, and you just search it real quick, so you don't have to like go get your book and like swipe through pages. You can literally just search keywords and it comes right up.
Yeah, that's cool.
Shout out to Will's Eye.
Technology. I'll not lie. Like sometimes I'll use chat because I'll be like, how do I do this? Or like, it's actually really smart. Like I'll obviously like, then I'll be like, oh, okay, I think I read that in Will's Eye. Let me check. But like for a quick search, sometimes I'm just like, into like chat because it just is so knowledgeable sometimes.
Just double check chat. Pat be
I
mixing
know.
it up.
You never know.
Yeah.
Like I was trying to write a prescription for Closey, shout out, and I was like, I think it comes in 30 vials or like whatever the dosage is. So I had to like look it up and like, yeah. So recently, shout out Closey. What about if you're seeing somebody, let's say for like a follow-up or they got seen last year and then they're like, my doctor told me that I had this, but then they don't have it. Like, how do you guys like handle that? Like, it's like, do you just feel like you don't know what to do? Or
I would
Give us
say
an
this one's
keep
funny.
going, keep going.
That happens all the time. So you're saying like they're saying they have a certain whatever, right? Like, and then
yeah,
but they
like they
actually
came
don't?
and they were like, okay, I'll give you an example. Like I
Yeah.
was seeing a patient at the Florida practice right when I was doing more medical. We could like manage glaucoma. So my patient came and he was like, I've been on latanoprost, blah, blah, blah. And I was like, okay, well, your nerves look good. Like you're really young. Like I don't see any like pressure issues. I was like, stop taking your latanoprost for 6 months and then come back. Not 6 months. Oh my gosh, 6 weeks. And then come back. We'll check your pressures again, whatever. Right. So they came back and like the OCT was normal. Their pressures were normal. Like I was like, I don't think you have glaucoma. Like I don't know why they started you on this drop. Like he had no family history. It was confusing, right? So like it was like, I don't really know why your doctor gave you that. Do you have the records? And they were like, no, they just gave me this latanoprost, blah, blah, blah. They said I have glaucoma. And then I was like, okay, well, don't take the drops. Let's just keep monitoring. So I would watch them like every 3 months. And like eventually after a year, I was like, you think you have glaucoma. But like, how do you handle that? Right. Because I didn't want to be like, well, your last doctor was a liar,
I
So like,
mean,
what's the delicate way of like handling situations like that? Right.
in that
That is
situation,
not yeah.
sounds like you did it the right way. I mean, you just have to cover your bases and make sure you're doing the checks and the follow throughs and the follow ups to make sure that they really don't have glaucoma. If it was a follow up in 6 months, that would have been crazy. So I'm
Yeah,
glad it
no,
was 6 weeks and not 6
yeah.
months. But yeah, I don't know. I've never seen something that drastic to where it's like, you definitely don't need to take that eye drop. I don't know. JD, what would you say?
I would say, in my opinion, this is what I believe, and then not even put the other person down, but without saying it, saying this is what I believe and this is what I'm going to do, and ignore what they said. Which happens all the time. I've seen plenty of people who, just because they have big C to Ds, physiological, it maybe seems high, but there's no cupping or notching. I'm okay with watching that every year or doing an optos every year. And so you just say, hey, this is my opinion. I don't believe that's necessary. Let's see you next year.
I
Or
just
like,
thought of an
I know
example.
I told you guys recently about the optic nerve swelling patient, right? So there was like, yeah. So in that situation, it was like the other doctor was like, let me monitor it, but I would have done something else. Like, what am I supposed to do in that situation? Like, it's not my patient. So like, what's the
Yeah.
ethical thing to do? Like, what do you do when you don't know what to do, right? Like, what do I do in that situation?
I think you focus on your patients, of course.
Yeah.
Like, if you're not in the room or you don't see the chart, like, you don't know all the information that's going on. That'd be
Okay,
my
I thought
thought.
of an example. So I had a patient and they got an eye exam like the week before at a different place. But they came to my office like a few years ago when there was different ownership. A few years ago, their prescription was like a plus 75 and a little bit of SIL. And then last week from the other place, it was a plus prescription and a minus prescription in the left eye. So I'm looking like minus plus. Okay. So I check it and patient was not a minus at all. It was definitely closer to the older prescription. So I'm like, okay, I do the exam, I get it, and it's closer to the older prescription. And then on the patient's telling me that, yeah, I don't know. I was telling the doctor that I can't see, and the doctor was like, no, just keep going, like push through. Because I was like, why did you decide to come in today and get a second opinion? And he said that's why. Like he kept saying he can't see, and the doctor was like, I just keep trying, you're fine. So I mean, I think you just kind of in that case, reassure the patient that, well, we got your best prescription today. You're seeing 20/20, and it is more similar to your older prescription than it is the one from last week. So let's go with this one. And then, like, even trial frame if you have to just give them that confidence that they actually are seeing well with that new prescription. Was there anything else that you guys would have done in that situation?
My vision fluctuates sometimes. You never know why it's like going up and down between like even between like refractions. Sometimes I'll have a patient that has such dry eyes and they come in the next week, it's totally different, or their blood sugars are messing with them. So I think just like background information is important. Like I had a patient that like 1 week they were Plano and the next week they were like a -2. And I'm like, something's like, when was the last time you got your blood sugar checked? Like this is not normal, right? So I think just like sometimes they don't even know, like they might not know they are like diabetic or why their prescription's shifting or whatever. So just kind of like thinking outside of the box. Like it's sometimes like refraction tells you a lot about like what's going on, right? Like sometimes you can't refract them anymore and you're like, okay, now I got to check the retina, right? Like why is your prescription shifting? Do you have swelling in your macula? Do you have whatever? So every refraction's like different and it gives you like clues to kind of what's going on too.
I think just to add on, I think you guys already said this, right? Like just talking to the patient and being honest and communicating and not being shameless, right? Like as Nadia was talking about some of her situations, like it reminds me of a lot of red eyes that come in and I'm like, for example, some situations that come up, like, is that episcleritis, right? Should I give this person a steroid? Do I want to have to go through all the effort? Do I want to see them back? I'll talk to them. Hey, look, is that a new red eye? And then they, try to get some case history on it. Hey, look, I can give you this medicine. If I'm worried about like their blepharitis causing injection on the cornea, and there's like blepharoconjunctivitis, and I'm not sure if I see the blood vessels actively moving, that makes me want to give like a steroid, right? So situations like that, like I'll talk to them, be like, hey, look, I can do this for you. I think it would help you, but then I'll have to see you back. And then they can say, hey, look, some of them will say, hey, look, I'm not going to come back no matter what. And then like, okay, no worries. I understand. Then I can't give you the steroid, but this is what I want to do. Like just having honest conversations with them and processing with them and saying, hey, even I'm not 100% sure, but I have to see you back if I have to do this. I feel like that helps too. Just like at least my conscious, like, hey, I can do this for you. I just need to know you. I need to see you back to check your LP, that kind of thing.
What about when you see something and you like don't know how to tell them it might be bad news? Do you just kind of like prep them up for it, or do you just send them to the OMD? Because like in that situation, it's like I don't know what to do, right? Like I don't know if I should be like, this kind of looks like cancer, or if I should just be like, yeah, that looks strange, not normal. Like let's get that checked out, Like, how do you handle difficult situations like that? Like, let's say they do have bilateral optic nerve swelling. Are you like, hey, you might have a brain tumor? Like, how do you handle those kinds of situations?
Yeah, no, it is tough when you're saying it's because you're probably overweight or fat or female or whatever, right? Like having some of those conversations. But it's also messed up not to be honest and tell them when there's like a cure of like, hey, you could just lose some weight, stuff like that. So I think I try to start it with like hey, I got some tough things I got to say. This might not sound comfortable. Like give some sort of primer so they're ready for it. Were you laughing, Doug?
I was laughing because how you said that was pretty funny. But yeah, I agree. And I also feel that I think you just have to kind of change your tone and also just educate as much as possible, but make it sound like be empathetic in how you're talking and how you're delivering. And also you don't want to freak them out. And you don't want them to feel like, oh, like this is cancer. Like, all right, you got to freak out. It's like, okay, like what I'm saying isn't really normal. This is what normal looks like, and this is what this could look like. So we just want to double check and make sure everything is hopefully normal. But let's have you get a second opinion with the specialist, and I'm going to refer you to them, and they'll know more about what to do. But this is what it could be based on what we're seeing here.
Yeah.
So kind of you're using your EI, your emotional intelligence, to kind of help you get through a situation.
Absolutely, because I try to like reassure them like you don't want to freak out. Like I haven't seen anything really super crazy to where it's like, dang, this is worst case scenario. But I try to just make them not say the things to make them not freak out, because I know like a lot of people have anxiety and like can take things from 0 to 100, especially with like Dr. Google.
What were you gonna say, Nadia?
I was gonna say It's crazy because sometimes I'll have like the same diagnosis that I like never see, but I'll have it like 3 times in a row. Like I remember one week I saw like 3 CIS patients, which is like this like a cancer of like your conjunctiva, and I was like, "Ooh, that again?" Like so like after a while I was just kind of like, "Yeah, let's send you to the specialist." But like I didn't have the heart to be like, "It's probably cancer," or something like that. I'm like, "It just doesn't look normal. I'd rather have it checked out." And then I would just let the OMD kind of deal with it.
I'd probably do the same thing too.
Yeah, because I'm not good at delivering bad news.
I mean, if you were confident it was, wouldn't you say it? Like, were you confident that it was?
Well, it looked similar.
After patient 3.
What do I know? Like,
Patient
I need a
3.
specialist.
3 times in a row. That second and third one, you're like, all right.
You weren't taking a biopsy. How would you know?
Right.
Yeah,
like,
So
I'm
you're
not
doing the wrong thing.
I'm not going to be treating that. They're going to need like certain.
Yeah. That's true.
So it's not my call because I'm not going to be doing the treatment. But I'm like, this looks not normal. This looks strange. So
I think that's the way to do it. Yeah.
Yeah, it's hard. Or like sometimes I'll see like a huge floater, like not normal, right? Like I said, and I'll like look around the retina and I'll be like, I don't see it, but I feel more confident sending you to the OMD and just having them do like sclerodepression on you or whatever, because I don't want to be the reason why, I don't want to be the last person who saw them and I was wrong, So sometimes I just refer. That's what I do,
How urgently do you refer them in that situation?
Yeah, I'll have them get in like either the next day or urgent. Like, let's just have it checked out. Like I always say, like, hopefully it's nothing, but we just want to make sure.
Those guys have it tough sometimes though, because they have to actually deliver the actual bad news and like confirm like it is what it is. Like that's tough. I want to like ask someone how they do that, how they deliver that actual bad news. For us, we're just like, this looks kind of suspect. Let's have someone else take a look. Which that's kind of cool. But that sucks to actually have to deliver that bad news.
Yeah, sometimes in low vision clinic, like for when we were in school, they would come in and we were like, well, that's it. You have a genetic disorder that your vision's not going to get better. And they would cry. And we would just be like watching our preceptors like, oh my gosh, this is so awkward, But like they would do it and they would be like, take all the time you need. And so, yeah, it's a lot. It's heavy. Like you have to go home with that every day. So I wonder how your friend does it, JD. You should ask him, your retina friend. Hey, checking in. You have to deliver some bad news lately.
I mean, that's a good segue. We have to do that sometimes in clinic, right? Like today I had a lady who was like, my husband died a week ago. And I'm like, oh man, like, what do you do? Like, what do I do? I mean, I didn't deliver the news her husband was dying, but I'm sure you've all had patients where, I mean, even if you had to deliver the news, right? Like, I don't know, I've had amblyopes who are like, hey, can this get better? And they're already past that critical age period and there's like a huge refractive amblyopia. And it's like, hey, I'm sorry, I know it can't, sometimes you have to just say it delicately, but honesty is the best policy there. It's the only policy. I don't think we have a choice. You can't lie.
Yeah, I know we had our therapy pod and I just divert. I'm like, I'm sorry to hear that. So how's your eyes doing? I feel like if we like get into it, we'll be into it for a while. So
True.
So I don't.
You gotta do better with that, Nadia. You gotta give them the time.
What am I gonna do? Be like, oh, tell me about your husband who died. Let's talk about that for 30 minutes.
No. You can just say, hey, look, I know it's a tough week for you. I appreciate that you want to take care of your health because that matters too, and that person will want your health to matter too. So let's focus on that.
I just say, I'm sorry to hear that. Tell me about your eyes.
That works too, I guess.
Let's keep it short and sweet, guys. Let's not.
Patient number 17.
If you're trying to go for some empathy, don't see me. I mean, see a therapist. Like I'm not.
Nadia's like, so 1 or 2.
Here for a job. I'm not certified in psychology. I need to stay in my lane. I'd probably give bad advice. I'd be like Doug. He's like, I'm pregnant. He's like, have you tried exercising?
I mean, I didn't say it like that.
Like, no, Doug.
We're looking for, ways to help you feel better.
Thank you. Feel supported.
Like I told you, I have a friend who literally worked out every day until 8 months. She's crazy, but she did it. Like she's hard, like working, like running miles. I'm telling you. Shout out to Danielle.
She probably was already running though.
Yeah, that is true. She was a workout.
True. You don't just start running when you're pregnant, right?
Yeah.
All of a sudden, I haven't been running for years. I'm going to start running now that I have another human being coming in me.
Never say never.
But don't worry, if you're my patient, Nadia. Nadia, if you told me you were my patient and you were pregnant, I would just say it's okay. I'm sorry for you. let's move on. You know,
I'm sorry
that was the
having a
method, right?
baby. Sorry
I'm pregnant
creating
right
the
now. Okay.
It's really funny because I'll, like I said, like I treat my patients like I'm like, "How have you been?" And then they'll be like, "How are you?" And I'll be like, "I feel good. I'm having a baby." But like if they try to talk to me, immediately shut down, you know? I'm like, "Have you ever been pregnant? Or do you have any kids?" "Oh my God, I'm feeling so nauseous, blah, blah." So yeah, I use that time to vent to my patients, but don't
Oh, Nadia,
don't try to vent to
this
me.
podcast shifted.
No,
What to
yeah.
do? You can decide what to do on your own. Everybody who's listening,
Just side
when you don't know
tangent,
what to do.
guys.
It was a good tangent.
I'm gonna be like, your optic nerve swollen. Have you tried exercising?
It's a good idea. A
Yeah.
great
Yeah.
idea.
I mean, if they're overweight and if they got diabetes, stop eating the sugar. If they got the bleeding,
Just let the OMD tell them refer. On
you
that
could do
note,
that. You could do that.
I think that's a good wrap up. Let's just wrap that
Yeah,
up.
let's wrap up there. Let's put a ribbon on that. Let's put a bow with it. And until next
Shout out
time,
to
guys.
Danielle
Shout
for
out to
running
Danielle.
for 8 months for her pregnancy.
I think she has 3 kids. I'm pretty sure she did it 3
my God.
times.
I can't.
Takeaway: get Will's iManual or pay for ChatGPT Pro.
Mm.
Network in your local town and meet some doctors, people you can reach out to, people you can refer to, people who are willing to answer questions, and even get the office, like, right? You're saying get the office manager or get the staff's phone number so you can get those patients in right away and build on those connections. And people want to help you in our field, so don't be afraid to ask those questions and get that help.
Just reach out to
And
JD, and then he'll reach out to the 20 OMDs that he knows. Next time I have a question, I'm just gonna be like, JD, can you ask your friend from Retina what this is?
We could here and there. I'll do it for you.
Okay, I'll just connect me with his number. I'll text him directly.
True, I could put us in a group chat and then I wouldn't say anything.
And that brings me to what I was going to say. Last but not least, develop your friend group, your core friend group in school, because with that, you will have your group chat that lasts forever, and you guys can ask each other anything you need at any time. They usually have your back because that's your team. So develop your team, develop your squad, and you guys will stick together forever.
My
Kumbaya.
squad.
On that note, we're out. You guys have a great rest of your week. We'll see y'all next time.
Hey guys, thanks for listening to the Depth Perception Podcast. Don't forget to like and subscribe on all of our platforms, including
Spotify,
Instagram,
Google Podcasts,
Apple Podcast.
YouTube. Make sure you click that button. Double tap that.
So you guys have no reason not to follow us and tune in to the next episode.
Stop wasting time.
Get in depth.
Subscribe.